Shot. All right, that worked. Great. Hey, welcome to the Duke Spine Institute. We are broadcasting spine surgery live at Duke Spine Institute. Our patient has a degenerated disc with a stenosis and neck pain at C6-C7. We've just finished accessing the disc through the front. He's having the Duke laser disc repair. And he also has facet joint pain, which we talked about, but he's electing not to get that treated at this time. I told him the facet joint pain will still be there after he wakes up. So there's two main causes for neck pain: disc injuries and facet joint injuries. Incision. We're going to make a 4mm incision. That's the width of our tube. All right, gentlemen, I need some help. Looking good so far. I've got my needle in, shot. That looks good. Let me bring the, I've got the guide wire shot. Perfect. We had a little bit of trouble getting in because he's got some big bone spurs anteriorly, but we were able to get past them. Now we've got a guide wire in the disc space, shot. Show the guide wire, Jordan. Sanjay, you could see the guide wire and the white arrow.
Yes.
You see that?
Yes.
All right. Shot. I'm going to bring the dilator down. You can see the endotracheal tube and the esophageal temperature probe as well. All right, we are now at the front of C6-7. Are you extending or flexing?
No flexion. Just inline.
All right, inline.
Would
Fine.
you like a little extension? I'm just getting inline right now.
It's fine. Slight extension would be good too.
Okay.
We're going to get an AP view, front back, to see that the tip of the dilator is in the midline. And it is. Try to straighten that out just a little bit. It's almost perfect, but you're off a little bit on the rotation. Shot. A little more. Shot. That's too much. Go back. Right there. All right, so you can see the tip of the dilator is in the center. It's just below the spinous process. There you go. Lateral view. Now that we know we're entering the disc in the middle, which is where we want, and you could be off of the middle by about 5 millimeters on either side of midline. It's fine. Yeah. Well, hold on. Let's see what we got. Shot. All right. So I'm going to try to advance this dilator right over the guide wire into the disc. Sometimes it's challenging. It feels a little challenging. I'm going to take this guide wire out at this point, and I'm going to advance the dilator with a little help from my team. Shot. We've got some inline traction, meaning we're pulling on the skull just to distract the spine a little bit so I can get the dilator in place. And this is a very degenerated disc. I can already tell. Look at the angle here too that we're dealing with. It's because it's so collapsed and scarred up, we're forced to go where the disc wants us to go, so to speak, rather than where we want to go. All right, that's good. Guys, we're almost ready. You want to take a break? You good? Take a break for a moment. Now our patient is asleep. He has a tube in his mouth down into his trachea, and he's on the ventilator, completely chemically paralyzed, we call it, where your muscles are not contracting. Everything's going well. He's stable hemodynamically. Our anesthesiologist has full control over the airway. We're going to bring down our tube so we could do the surgery endoscopically. Now, most doctors would end up fusing this because that's really all they know how to do for this problem. However, we can do a fusion, or we could do something less invasive. The patient didn't want fusion. That's beautiful, guys. He wanted nice distraction. Good. You guys are doing awesome. almost there. Just about done. Shot. All right, that's good. Let's see where that gets us. So you can see I had to really hammer that in the tube because the disc is so scarred and collapsed from inflammation called discitis. Discitis is inflammation of the disc, and that's what this patient has. And that's led to degenerative disc disease. So a lot of people don't realize that the cause of degenerative disc disease is discitis. And the discitis comes from inflammation in the annular tear from the herniation. Let's go ahead and show our educational video.
Copy that.
Man, look at that angle.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.
You've been looking for a job?
Oh, looking for you.
I appreciate that. All right, welcome back. I'm joking, you know that. As you can see from the video, that the cause of neck pain is actually inflammation within the, get that out of there. I don't know, it used to work, it's not working. It's just causing problems. You're gonna break the laser fiber. Meanwhile, we're trying to remove the herniation and bone spurs. No, this thing is broken now. It's not moving. It's not engaging the teeth. Nope. No engagement. It's not working. Get us another tube.
Another tube, deodorant, please. Yeah. Thank you.
Ridiculous. That's not going to do anything, Louise. Need a dilator. Mallet. Let me see that. No. Yeah, the problem is that there's, as soon as you take this out, we lose enough contact to allow me to move it. So we may have to replace the tube. You can see how stiff this joint is.
Lights on, please. Thank you. Stop off.
Check the fiber. Is it okay?
Yeah, yes.
Smell it. As long as this is in, I'm able to manipulate it. That's a bone spur right there. Because the problem, folks, is the angle of his chest is literally, and the angle of his disc are fighting my equipment. So I'm making it very difficult. There's a piece of herniation. Again, C6-C7 is very difficult to treat in a lot of patients because they have such thick necks, and 6-7 is at the bottom of the cervical spine. So you really have to struggle surgically to get to it. And in his case, he's not making it easy for us because he has this anatomy that's fighting my tube and my equipment. So that's surgery for you. You know, sometimes it's easier, sometimes it's harder. Same thing with anesthesia. Sometimes it's easier, sometimes it's harder. And in the end, every patient is different. I mean, everybody is different, right? They may have the same condition, degenerated disc, but they don't have the same anatomy. And therefore, they don't have the same physiology. Therefore, the anesthesia is always different, and the surgery is always different.
Lights on, please.
As soon as I put this in, it's amazing. It works. I'm going to try to angle it off to his right.
Thank you.
You guys see how the chest is blocking us here, Henry or Sanjay?
Yes, we do.
So what I'm doing is I'm repositioning the tube. And every time I reposition the tube, I'm going back in, trying to get a little bit more of the herniation and bone spur. This is bone spur. That's looking good. Any questions from our audience?
No questions so far, but we have a comment from Allison on LinkedIn.
From who?
From Allison
Uh-huh.
on LinkedIn.
Okay.
He says, "We are grateful to Dr. Duke and his team. We look forward to our turn for my wife. She has been in so much pain, and to do it while being Caesar active."
Okay. I have to work on Sanjay's language skills. Thank you, Sanjay. This is all bone spur here. And some of it's not creating any problems, and some of it is. We're only going to go after the stuff that is creating problems. All right, I'm going to have to reposition again.
Thank you. Off. Thank you.
You can see the spinal cord there, it's decompressed. You guys see that window right there down there? That is, we've already removed the herniations. That is the spinal cord.
Lights on, please. Thank you.
I'm just trying to get a little more to the foramen. Just about done. Oh, yeah, we're almost done. Sorry if I didn't tell you. Probably another 5 minutes. Let's flip it. Now, as I said earlier, he's going to need his facet joints treated because he's got facet joint issues as well. And I talked to him about that ahead of time. I really think the facets are a big part of his pain. Two more minutes, probably.
Lights on, please.
Move this out of the way. Strange how.
2 minutes?
Yeah. That's going in. It's very strange. That's going in.
Bruce, you're gonna use CPAP on the next one.
Yeah.
Just letting Luis know, all right? Just CPAP on the next, perfect.
I'm glad we're only doing one level. What? I don't think we need to. We're pretty much done. I mean, let me just see. Because I'm literally got 1 minute left. Just getting out these last few pieces. Uh-huh. That's fine. There's another piece. Looking good. I think we're done.
Lights on, please, thank you.
All right. Just give me the betadine. Let's go, betadine. Come on. Waste time with that. Here. Dilator. Did you forget the sequence? All right, well, lots of osteophytes, very collapsed disc. But we were able to get what I think the central herniations out. You can see the dura. And I think his biggest problem at this point is just going to end up being his facets. I need that dilator. Uh-huh. Mallet, okay, there we go. Yeah. Once you put the dilator in, it gives it a little bit extra strength. Look at how difficult it is to get this out. It's incredible. Wow. All right, let's show the video on how the Duke laser disc repair works.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.